Hello, welcome to this session. So let's begin. There are few MCQs for NEET MDS. So in incipient caries, surface zone is relatively unaffected. So here's the explanation. This enamel caries lesion appears as white opaque spot. There is area of demineralization, and this zone of incipient caries have four zones: surface zone, body of lesion, dark zone and translucent zone. Usually incipient caries disappear visually when enamel is hydrated, while hypocalcified enamel is relatively unaffected by drying and wetting. For treatment purpose, right treatment is given. Sealants are given. That sealants help to dental sealants prevent and treat tooth decay. Another is ACP, that is amorphous calcium phosphate. Basically, it remineralizes the teeth. Calcium pyrophosphate in toothpaste, it raises effectiveness in enhancing remineralization. The minimum depth of detectable caries lesion on a radiograph is 500 micrometer. Approximately 60% of teeth with radiographic proximal lesions in the outer half of canteen are likely to be non-cavitated and should be remineralized rather than restored. Which of the following statement about an amalgam tooth cavity preparation is true? The cavo surface margin should provide for a 90-degree amalgam margin. So here the amalgam margin must be 90 degree. Although the amalgam margin must be 90 degree, the enamel margin may not be 90 degree, especially on occlusal surface. Most walls converge occlusally, but many class 5 amalgam preparations have walls that diverge externally. No retention form should be placed at dental enamel junction. Otherwise, the adjacent enamel will be undermined and subject to fracture. Ideal marginal metal for cast inlay restoration should be 30 to 40 degree. The resulting occlusion margin metal of inlay should be 40 degree. The occlusal marginal enamel is 140 degree enamel. Traveling the occlusal margin increases the strength of the marginal enamel and helps seal and protect the margins. In tooth preparation design, mesial and distal margins of class 5 direct gold restorations are in straight line and meet at the occlusal and gingival marginal in the sharp acute angles and sharp obtuse angles respectively. So here the mesial and distal margins are parallel to the proximal line angle of the tooth and usually are positioned sufficiently mesially and distally to be covered by free gingiva. The mesial and distal margins are straight lines that meet at occlusal margin in sharp acute angles and meet the gingival margin in sharp obtuse angle, both of which complete the trapezoidal form. Each of these is GIC with resin system added. So here resin modified glass ionomers, that is gamma and tectama, these are added to powder and hammer to the liquid, and with the exposure of light polymerization is initiated among the methacrylate group. After the liquid reacts with the glass particles through acid-base reaction, improves wear resistance and decreases the sensitivity to water attack. Compomers, these are the combination of composite and GIC. Glass particles are partially silinated for bonding with the matrix and are added as fillers in the composite resin. There is no water in the reaction. The properties were inferior to composites but superior to resin modified glass ionomers. Third is glass cermet or cermet. This is a combination of glass and metal. Silver, tin and titanium powders were sintered at high temperature and made to react with the liquid. It improves the fracture toughness and wear resistance, and it maintains the aesthetics. Next is miracle mix of silver cement. That is silver tin alloy powder is added to GIC powder. Electrochemical corrosion of copper tin. High copper amalgam produces copper and oxychlorides and tin oxide. So in electrochemical corrosion of copper tin in high copper amalgam produces both copper and tin oxides and oxychlorides. No mercury is involved in this. Next is method of detection of cracked teeth, that is transillumination test. So here fiber optic light source is used, or other is digital imaging fiber optic transillumination. Metric band should be above the adjacent tooth occlusal surface by 1 to 2 millimeter. So band should be seated around the tooth such that occlusal portion of the band extends 1.5 to 2 millimeter above the marginal ridge of the adjacent tooth and the cavo surface margin. This allows for proper condensation of amalgam in marginal ridge area. The gingival portion of the band extends 0.5 millimeter below the gingival margin, and the thickness of band is 0.05 millimeter, that is 0.002 inch. That's all for today. Do like and share, subscribe for more updates. Thanks for today.